Hi dear nurses, good evening. On behalf of Bemax Academy, I am welcoming all of you to the live session. So, my name, I am a nurse trainer from Bemax Academy. So, let's see about a small description about all the courses that we provide for nursing licensing exams, and we will discuss about a small demo sessions on the class. Okay, let's move on to the slide. So, first thing, for providing nursing licensing exams, we are giving HAAD exam coaching, MOH coaching, DHA coaching and Prometric courses. Let's see in brief. So, first thing, we are providing 3 type of courses in the academy. So, first one is nursing HAAD exams and all the licensing exams like DHA, HAAD, MOH Prometric in a duration of 60 days. Okay. So, this course is suitable for all the people who are working and having a knowledge gap. Okay. So, you can follow that classes. In this session, it is only provided in online format only. Okay. So, you can attend the class in every day at the time of 7 to 9. During that time only we are providing the class. So, this is suitable for all the people who are working in a clinical scenario. Okay. So, next one is second course. We have second 2 courses are in a crash format. So, so to attend these classes, you can come as online and offline. We are providing a 10 days crash course. It is available only in the Mevaram branch of Bemax Academy in Kollam. So, in this class, we are providing extended coaching regarding nursing exams like DHA, HAAD, MOH Prometric and PEARSON VUE exams. Detailed question answer discussions and theory is covered up in the class. Okay. So, 10 days classes, your hostel facilities are also provided. This is about the class section. It is only in an offline format. So, you have to take 10 days leave and attend the class. That is the form of this class. So, we will see in detail also. Next one is known as 6 days crash course. In this class, we are providing all the licensing exam coaching along with the offline and online. So, if you are anywhere from the country like in India, any other countries also, you can attend the crash course if you are interested. So, but you have to get a time period of from 10 to 5 during 6 days. Okay. So, 10 to 5 time AM to PM you have to be free, and also you have to be available to attend 6 days continuous class through online mode, and offline mode is available. Offline is available in all the branches of Bemax Academy. Okay. That is about the class session. So, we will see that what are the things that we included in the class. First one is full access to Bemax application. So, in the application we will provide materials like PDF materials are there, already recorded classes are there, and question sets is there, previously appeared questions along with lot of MCQ test series are available. So, you can practice like your final exam. So, like that you can practice with the time also there, and also preview is also available. So, you can see that how many questions you missed up, and you can re-attempt the questions also. When you submit the questions, you can see solutions along with each and every wrong answers. Okay. That is about the application access. Then you have an expert mentorship and live doubt clearing sections also provided with all the classes. Then topic wise notes are also provided with the textbook is also we are providing. That is a test material that is also available with us, and you can also easily brush up all the topics when you are in a rushing time. Okay. Then mock exam series is also available. You can follow that also with the application service. Then if you utilizing the application, we will whenever you get a free time, at that time also you can see all the PDFs, all the recorded classes. If you miss the classes also, you can follow the recorded classes that is available in the application, and also follow with all the question answer. Detailed discussion is also available. If you have any queries during practicing the questions, you can note down the questions and ask to us. Okay. The trainers will also respond to that. This is about the application and services that we provide. So, weekly mock exams also available for all the crash courses. So, in crash courses like 10 days crash, 6 days crash, mock exams also provided in the end of the classes sessions. Okay. During the end of the days, we will providing mock exams for the people. For 10 days crash, in every afternoon sessions, we will get a mock exam. Like that we are providing. Then in 60 days class, people can have weekend mock exam sections are available for them. Okay. And also the answer sessions are provided along with the next class sections. This is how we will running up the classes. So, let us have a small demo on how we are taking topics. Okay. So, let us see mental health nursing. I know that this topic is really tough for most of the people, but like let's make it more interesting when we are dealing with the class, okay? So I am only taking a single topic that is known as schizophrenia. So schizophrenia, it is a condition, it's known as split mind disorder, split mind disorder. So we have a splitting inside the mind, okay, right? So it is proposed by Eugen Bleuler. From the word itself, what are the conditions we are studying in the psychiatry? This is coming under schizophrenia patients, okay? So let's see that it is a disorder of the mood, behavior, affect, personality, thought, and illusions, hallucination, delusion, all those things are there. Personality is also affected. So all the conditions we are studying in psychiatry is coming under schizophrenic patients criteria, okay? So when we check a patient with schizophrenia, at that time they have a increased neurotransmitter levels like dopamine and serotonin in the blood. So they will have an increased neurotransmitter like dopamine and serotonin. This is important. This is asked for the licensing exam, so you should know that. Then when we see a patient in psychiatry, first and foremost we can see that the patient will be having a patient can have that unkept appearance, right? So they will be having less hygienic, isn't it? So it is known as unkept appearance. As such, the word you can expect it to have in question scenario sessions, okay? So you should please remember unkept appearance is known as poor hygiene. Then body image disturbances will be very common. They will be very shabby and also not forming that sleep and elimination, everything will be disordered, right? So neglect in hygiene, eating, sleeping, elimination, and also preoccupied with the somatic complaints. What is meant by somatic complaints? Have you any idea about somatic complaints? So preoccupied with somatic complaints means patient can have, because of the mental illness, patient is having some physical discomfort. Example, it's a small example, not in schizophrenia, okay? So whenever we have a stress, right? So when we are facing an exam, you will feel excessive urination, right? Because of some mind disturbances, we are having some physical symptoms. Like that, patient can have some of the somatic complaints, okay? Somatic complaints means complaints related to the body or physiological changes because of the mind illness. Clear? So that's how the patient can have in physical symptoms. Next we will see about emotional characteristics. What are the emotional changes the patient can have? First thing, mistrust. They will be very much having trust issues with other people. They will not trust anybody, okay? That is a more confusion and they are not able to reliable to others also. Then hostility. Hostility means what? They will be centric. They are not, they are considering everybody as an enemy, okay? They only feel that they are the right person, they are the only trustworthy person. Other people will be considered to be an enemy to the patient. That's how the patient will feel. Then anxiety, there is no need for explanation. Anger and guilt. Then depression, ambivalence, and also confabulation and thought process abnormalities. Thought process abnormalities we will see in next slide. So let's discuss about ambivalence and confabulation. Ambivalence means, ambi means what? You can example, frog is an ambivalent, right? So it can live in both water and land. So like that, the patient will feel that inside the mind they will have confusion with positivity and negativity. Whenever you ask a question to the patient will think about the both sides. They are unable to take a decision. So they will feel that two sides of a scenario. So they are unable to take a decision. That is known as ambivalence. Next one is confabulation. That means filling up of memory gap with a detailed fantasy. For example, when you ask a patient that how did you reach to the hospital, okay? So at that time the patient says that I am coming with my friend. So at that time we are taking a taxi and reach to the hospital. So at that time during the conversation in between the patient will take a pause. So after the pause patient says that I had a horse and ride to the hospital. Like that the patient will say. So from the scenario itself we can identify that they are filling this memory gap with a detailed fantasy, not a reality. That is known as confabulation. Okay. Let's see about problems in thought process. First one is flight of ideas. Flight of ideas means what? They are jumping from one idea to another with a connection. Okay. So with a connection they are jumping from one idea to another. That is known as what? Flight of ideas. Neologism. Neologism. Neo means new. So they are coining out of new words that only understood by the patient itself. So it is known as what? Neologism. We cannot understand the word that the patient claims, okay? So that is known as neologism. You can assume like coining out of new words. Then next one is word salad. Word salad means what? Salad we all heard about, right? So it will be mixed fruits and mixed vegetables, everything will be like a salad. So they will use words and phrases as a mixture, okay? There will not be any meaning for that. That is known as what? Word salad. Next one is loosening of association. From the word itself, it is easy for us to understand, that is, they does not have a connection between the sentence. They will talk more, but there is no connection with each and every one. So each and every thought is different from, there is no connection. That is known as loosening of association. Then thought block. Thought block means in between a concentration, patient will take a pause and they will not talk. That is known as thought block. Cessation of thought in the middle of a conversation is known as thought block. Next one is circumstantiality. It's really quite interesting because when we deal about circumstantiality, did you ask a question? When you ask a question to the patient, so like example, I am asking a patient that, have you had your breakfast? At that time patient will respond like, you can say both answers, right? Yes or no you can say, or anything did you had, you can say the food item. Other than that, the patient will say that, when I went to the kitchen to take a breakfast, at that time there is no breakfast. So I went to take things to make the breakfast. Like that he will explain all the scenario behind the scene. That is known as what? Circumstantiality. Is it clear? So they will explain all the situations behind the area. That is known as what? Circumstantiality. Then last one is known as persecution. This is the last one in thought process. We have some other thoughts also, we will discuss it later. First, so this one, persecution means what? They have a false belief on that somebody is going to harm them. That is known as killing perception, abnormal killing perception. It is a false belief in the client. Okay, so that is known as what? Persecution. Clear? These are the thought problems we can see in the patients. Next one, abnormal motor behavior. What are the behaviors the patient can assume during the course of illness? So first thing is echolalia. Echolalia means echo. Have you heard about echo? So echo means what? Echolalia, in that patient will repeat the last word of other person. Whoever talking to the person, at that time the patient will repeat the last word that is taught by the other person. For example, if a nurse is talking to the patient, like, have you had your breakfast? The patient will repeat like breakfast, breakfast, breakfast. Okay. So that is known as what? Echolalia. Then you have one more word, that is palilalia. Please mention palilalia. Palilalia means what? These all things are terminologies in psychiatric nursing, right? So you should know every terms in detail. So palilalia means what? Patient, P for patient, please remember like that. Palilalia means patient will repeat the last word he says. For example, I had my breakfast, that's the answer of my patient. So patient will repeat like breakfast, breakfast, breakfast. Like that also we can say. So like that we can explain this echolalia and palilalia. Next one is echopraxy. Like echoing what is happening. Praxy means movement. So they are repeating the other person movement is known as what? Echopraxy. Some actions, gestures are followed by other person. Other person's actions are followed by the patient. That is known as echopraxy. Next one is waxy flexibility. From the word itself, wax, you can see that, no? Wax will be, that's not moving, right? So waxy flexibility means patient will assume a position. That position will be maintained for hours. Without any change in the position, they will be assumed to have same position for a period of hours. That is known as waxy flexibility. Then dyskinesia means difficulty in initiating movements. They are unable to initiate the movement is known as dyskinesia. Next one, stupor. Stupor and unconsciousness having a unconsciousness or coma, and stupor is having a similar appearance, right? So stupor means what? Patient will be conscious, but they are not moving their body, only blinking the eyes only, okay? So that is known as stupor. But in coma, what happened? Patient will or may not be blinking the eyes, but they are unconscious also. That's the difference between stupor and coma. Stupor is very common with these type of schizophrenic patients. Next one, these are the most common features we can see in the client. But when we see about the cardinal features of schizophrenia, we have two types of symptoms. First one is positive type symptoms and second one is negative type symptoms. Okay. So first type is known as what? Positive symptoms, right? Positive symptom, from the word P you can see that, right? So P, from there you can think about it. P for positive signs, the patient will be a problematic person. Okay. So we are unable to manage the person. The nurses will be we will need more effort to manage the person. The patient will be very much problematic. That is positive symptoms in the patients with schizophrenia. So in that we can see hallucination, delusion and disorganized thought and also bizarre behavior. Bizarre behavior means aggressive behavior, okay. So these are the features we can see in positive schizophrenic symptoms. Next one is known as negative schizophrenic symptoms. In that we have different types. So when we deal about all the motor, thought problems and everything previous slides, right, these all things are coming under negative symptoms of schizophrenia. Along with we have some other also. First one is flat affect, that is there is no emotions. Patient is less expressive and they have a mask like face. They will not express their emotions. That is known as flat affect. Next one is reduced social interaction. They will be isolated or detached from the social relationships, okay. So that is known as reduced social interactions. Then anhedonia. Anhedonia means no feeling of enjoyment. You can explain like that. Whenever the patient is under stress, previously they will use like going for trip and hearing some music, doing some recreational activities to manage the stress, right. But when the patient is having this condition, at that time they are not having interest to do those all relieving factors. That is known as anhedonia. That is they are not interested in previously pleasurable activities during stress event. Then abolition. Abolition means less motivation. The patients are not motivated to do anything. They are not motivated to do anything like self-care activities, eating, sleeping, hygiene, everything will be less motivated. That is known as abolition. Then alogia. Alogia means speaking less. They are not interested to speak. They will be mute. Most commonly they will be in a muting manner. So we can see that alogia. Then last one is catatonia. Catatonia means moving less. Tonia, catatonia, we can say that it is a moving less. Patient will be assuming some position like stupor, waxy flexibility, immobility, like that. So these are the negative symptoms of schizophrenia. So here what is happening? Negative symptoms means what? They are not having a healthy behavior. But these all things are not normal, right? So they are not having a healthy behavior, but there is some problems. But it is quite more manageable than the positive symptoms. Is it clear? This is how the patient can have positive and negative symptoms in schizophrenia. So let's move on. So we told that no delusion, illusion, hallucination and everything. So let's see in small detail of delusion. So delusion means what? False, fixed, unshakable belief is known as what? Delusion. What is delusion? False, fixed, unshakable belief. So they will assume that something is there, but we will not be, other people are not able to interfere with their thought. Okay, they will fix it with their false belief. That is known as delusion. So we have different type of delusions. First one is grandeur delusion, second one is delusion of jealousy, and third one is their delusion of persecution. So first one is known as what? Grandeur delusion. Here false belief that one is a powerful and important person. The person will feel, the patient will feel that he is the God. Like that he will feel. For example, like he will feel that he is the God or he is the ultimate power. Everybody has to pray for him. Like that he will feel. So like he will feel that he is a chief minister, prime minister, like that. All power holding position he will assume. So that is known as what? Grandeur delusions. It is very common in mania. Very, very important. You can expect, surely you can have questions from schizophrenia in all the licensing exams. Okay, that's why I introduced this area in demo sessions. So let's see grandeur delusions. Then next one is delusion of jealousy. Here what is happening? They have a false belief about a doubt of a one person. It is very common in alcoholism patients. Like we will see that, no, substance abuse disorders, then patients with the chronic alcoholism and they are coming for de-addictions. So we will introduce medicine for the patients. When they are not using the alcohol at that time, they will feel delirium symptoms and also withdrawal symptoms. So during that time, the patient can feel that what? Delusion of jealousy, that is they are doubting someone. For example, you can more easily relate that most of the alcoholic people, they will doubt their wife, isn't it? So that is very common with the delusion of jealousy. Then delusion of persecution. Previous slide I told you, know what is persecution. So they will feel that everybody is trying to harm him. So like that they will feel that is known as delusion of persecution. Clear? These are the 3 types of delusions. Then how we will manage the patient with the delusion? First and foremost, we should tell the patient that it is not real. Okay, your feeling is not real, that we have to communicate to the patient. Next one, don't be aggressive. In psychiatric conditions, we have to very much focus on management, okay, because we will expect to have more questions from the management sets. So delusion, what are the things? First thing we have to do, present the reality to the patient. Next one, not be aggressive to the patient, okay. Then third one, don't argue with the patient. Fourth one, encourage the client to express the feeling, what the client feeling inside. Then only we will be able to identify that what type of delusion the patient is having. Based on that only we can able to manage the patient, right. So these are the type of management we can give for the patient with the delusion. Next one is known as abnormal perception. So in that we have 2 conditions, that illusion and hallucination. Illusion means what? It is a misinterpretation of the stimulus, right. So when there is a stimuli is there, the client is interpreting the stimuli in a wrong manner. For example, most common example that's known as IV tubings, the patient assumes that it is a snake, like that, or a rope is considered to be a snake. Reverse also, a snake is considered to be a rope. So like that they will see. So that is known as what? Illusion. I think it's clear. Next one is hallucination. So there is no stimuli, but the client is having some interpretations or perception of the stimuli. So example, there is no stimuli, the client will feel that some perception of the stimuli. Example, they say that they seen a ghost, they heard someone voice, some lost people voice they heard, some touch sensation they feel, like that they will say. So that's our example. So we have 5 sensory organs like auditory, visual, tactile, olfactory, gustatory. These all which senses will have that sensation of perception, wrong perception, that is known as hallucination. So we have different type of hallucination. Auditory, that is known as they are hearing something wrong. Then visual, there is no stimuli but they see a ghost. Tactile, they have something crawling in the body, that is tactile, touch sensation. Then just olfactory, they have smelling some wrong smell or anything like that they can smell. Then gustatory means what? They feel some abnormal taste. These are the types of abnormal perception coming under hallucination. So let's see. Okay, so let's see about the management, how we will manage a patient with hallucination. First one is encourage the patient to verbalize the feeling, that then only we will be able to identify that, what type of hallucination the client is going on, right. So that we will identify. The next one is present the reality to the patient, avoid touching the patient, should not touch the patient. Patient will be more violent when we touch the patient, okay. So that is very, very important. Then decrease the stimulus in the environment, like shifting the patient to another area. For example, if a person feel anxious and having hallucinations in the dark room, then we will put on light on the night times, right. Then if a person feel hallucination only at alone period, so we will accompany the person with another person. Like that we will convert the situations that is triggering with the patients to have a hallucinations. So how we will manage a patient with a hallucination. Then let's see about type of schizophrenia, okay. So we have discussed about all the symptoms of schizophrenia. So let's move on with the type of schizophrenia. First one is paranoid schizophrenia, okay. So paranoid means what? Paranoid means the client is very much suspicious to others, that is known as paranoid. So the patient is more suspicious, hostility will be there, delusion, hallucination with the auditory sensation, anxiety, anger and violence. This is how the patient will be experiencing symptoms. Okay, that is known as paranoid. They are not able to have a reality with them. So they have suspicious, hostility and some other features also. Then catatonic, from the word itself they have movement related issues. For example, stupor, immobility, waxy flexibility. These all things we have explained previously. So I am moving on. Next one is known as residual schizophrenia. Here what is happening? The client has a schizophrenic event, but it has cured also, but it is recurring during progression. So when they are advancing with their life, they having a recurrence of schizophrenia. It is known as residual schizo. Then disorganized schizo. They have a disorganized thought process will be there, speech behaviors is there, and also withdrawal symptoms. Speech problem, disorganized speech, and withdrawal is considered to be disorganized schizophrenia. Then fourth one is known as what? Simple schizophrenia. In this, they only have a negative symptoms, okay. So they only have a negative symptoms, no more positive symptoms with the patient. That is known as simple schizophrenia. I think it's clear about 5 types of schizophrenia. Let's move about management of schizophrenia. Here also I know that's repeating. So let's see, assess the client physical need. That is a prime concern. We should assess about the physical need. Whenever considering about Maslow's hierarchy of needs, the basic thing is coming under physiological need satisfaction, right? So first and foremost, we will take care about the physical needs. When you get a scenario based question and in that the patient is explained with the poor hygiene, definitely we can choose with the physical care, okay. So if a patient is having anxiety symptoms, delusion, hallucination, illusion symptoms are explained in a scenario, then definitely you should choose with the safety, okay. Patient safety is the next consideration, clear. So we will see that maintain safe environment for all the patients, then remove all sharp instruments for the patient safety, participate with the one-on-one interaction with the client, never have a group discussion with the client, only have an individualized attention. Next one is spend time with the client is unable to respond. The client is having struggles with responding and frightened. During that period, we should be accommodative with the client, okay. We should reassure the client and also we will offer ourselves to the client. Then avoid touching the patient is very important. Sit with the client silently whenever they are talking, when they need our presence also, be with the patient. Then tell the client where you are living, and it's very, very important because if you are in off duty in the clinic, so you should tell the patient that I will not be coming to tomorrow. Like that you should encourage, you should inform the patient, otherwise patient will be more anxious that you are not there, okay. So that also important. Then present the reality to the client. These are the things coming under management. Next thing, do not make fake promises to the patient, okay. If you are not able to follow any promises, should not keep it to the patient, should not make. Then provide simple creative activities such as puzzles, games can be provided to the client to solve them. Then use canned and packed food. Why we are giving canned and packed food for schizophrenic patients? To increase their concentration and attention, okay. So that's the purpose. Stay with the client and he or she is frightened. Monitor for suicidal tendencies, very common because they can have depressive symptoms and also tendency to suicide. So we should be watchful for that. Then radio can be provided. Watchful for insomnia. Last one is antipsychotics. This is the category of drug most commonly we are giving for patients with schizophrenia. We have 2 types of antipsychotics. Definitely you can have question from this area, it is very, very sure. Okay, so we have 2 types of schizophrenic antipsychotic drugs, right. First one is typical antipsychotics, second one is atypical antipsychotics. So typical antipsychotics, so previously in centuries like 20 centuries and above, so typical antipsychotics are the only drug that is provided for both positive symptoms and negative symptoms. So we all know that positive symptoms, they have a problematic behavior. Negative symptoms, they are not normal, right. So in this scenario, when we give this drug, patients with negative symptoms, they don't need this much composition of the drug. Okay, so patients develop lot of complications after consuming the drug for a long period of time. That is known as side effects of the antipsychotics. So because of the side effects of antipsychotics, typical antipsychotics, they have developed another category that is known as atypical. Okay, let's see the examples of typical and atypical. Please study at least these 5 drugs. Very, very important. Typical antipsychotics, they will consider to have chlorpromazine and haloperidol. These are the very common drugs commonly used in the clinical scenario. Next thing is atypical drugs, in that risperidone and olanzapine and clozapine. Risperidone, olanzapine and clozapine are the examples of atypical category. Clear? So when we use atypical, I previously told that when a patient is using typical for a long period of time, they had a lot of side effects, that is known as EPS, extrapyramidal symptoms. Let's see extrapyramidal symptoms in detail. Okay. Nowadays we are having questions based on these symptoms. Okay. They will give the symptoms in a scenario. You have to identify what type of EPS is coming for the patient. So it is important to study all the symptoms in EPS. So EPS we have 4 categories of symptoms. First one is pseudo-Parkinsonism, second one is akathisia, third one acute dystonia, and fourth one tardive dyskinesia. So pseudo-Parkinsonism means patient will mimic like a Parkinsonism patients. Okay. So we have a Parkinsonism symptoms like stooped posture, shuffling gait, rigidity in all the muscles, and bradykinesia, tremors at rest, and pill rolling movement of the hand. Pill rolling movement of the hand means like this. They will roll the fingers in between. That is known as pill rolling movement. Very common with Parkinsonism. Then tremors at rest is also very important. These all features are seen in Parkinsonism patient. When a patient take antipsychotics, typical they will have pseudo-Parkinsonism symptoms. Next one is known as akathisia. Here patient will be having restlessness, they have trouble in walking, they have 2 and 4th movement of the foot. That is known as what? Akathisia. Okay, so they are unable to stand still. That is a feature. Then acute dystonia, from the figure itself you can see that no, neck will be rigid, facial grimace will be there. This is grimacing. Okay. So grimacing will be there, neck will be rigid. So dysphagia, swallowing difficulty, spasm of the eye movements, laryngeal spasm, these are common with the client. So they are unable to swallow also. Okay. So they will compromise with the aspirations. That's how the patient can manifest. Next one is known as tardive dyskinesia. In tardive dyskinesia, from the figure itself you can see that no, this is known as what? This is ptosis of the eye. So when we have a closure of one eye, that is known as ptosis of the eye. Here protrusion of the tongue and also rolling of the tongue, sucking, smacking, movement of the lips, chewing motion, facial dyskinesia. So face is the patient is unable to express through face. Okay, so facial dyskinesia, involuntary movements of the body and extremities. So body is having some involuntary movements in throughout the body. This is how the patient will be having in tardive dyskinesia. Okay, so these all areas very important. These are known as EPS, extrapyramidal symptoms, occurs as a side effect of use of typical category of drug for a long period of time. So that's about schizophrenia. I think it's clear, all of you. If you have any queries with all the classes, and we will see in between. So if you have any queries related classes, courses and everything, you can reach Bemax Academy. Thank you so much.